The largest joint in our body is the knee. That is the largest joint in our body. The knee comprises of femur, that is the thigh bone, patella, that is the kneecap, and then the tibia, that is the shin bone. As we get older, so many people give up on us. So many things give up on us. One of the things that could also give up on us is our knee. So let's pay attention to our knee health, okay? Number one on the list is exercising. Exercising the wrong way, 90% of the exercises we do causes us knee problems, knee inflammation, knee injury, okay? Deep squatting. When you deep squat, you are messing the muscle around your thigh, around your shin, around your kneecap area. It's very important. When you run on hard surfaces, it's eventually wearing and tearing on your knee. When you high jump, you have to come back down. When you bend down, you have to bend the knee, causing wear and tear on the knee. Okay, it's causing micro injuries. Those micro injuries eventually lead to major injuries in the future. Okay, number two on the list is excess amount of sugar. Too much sugar. Let me break something down for you to understand. Sugar contains two things. That is the sucrose and the fructose, right? The sucrose and the fructose itself is being metabolized only in the liver. The liver is the only place that metabolizes the fructose. Once the metabolism takes place by the liver, the fructose turns into uric acid. The uric acid will cause you knee inflammation or knee problems, gout. Okay, pay attention to that. Once we stop eating too much sugar, we will end up now going to the doctors. We will end up now going to have that knee surgery. Okay, let's cut down. Let's permanently stop eating too much sugar. All right, it's going to help us a lot. Number three on the list is crossing your legs for so long. Once you cross your legs for so long, you are reducing the lubrication that takes place in your knee. Okay, the cartilage around it receives less blood already. So once you cross the legs, you are causing all that vasoconstriction, less blood flow into your knee. Okay, we cannot do that. It increases pressure on your knee. Pay attention to that. When you sit, you could cross your leg, but at some point, just let it go so we could have some free blood flow into our knees, okay? We don't want to have any knee problems in the future. Number four on the list is smoking. Smoking has nicotine. Nicotine slows blood already. The cartilage already is the only part of the body that receives very, very less blood. So the smoking, the nicotine bringing in the blood is already very, very, very short. The cartilage itself is already depriving of blood already. So the nicotine with the smoking will mess up your knee, eventually causing you unnecessary knee problems. Okay, it could cause you knee problems where you have to do knee surgery. Total knee arthroplasty, okay, or partial arthroplasty. So let's stop the smoking. It's going to help us a lot, okay. Number five, obesity, or let's use a word, let's say chronic overload. Chronic overload can be modified, it can be changed, it can be reversed. Obesity causes muscle imbalance. That muscle imbalance is sitting on your knee. It's not good. When we get fat, the fat secrete, or the fatty tissue secretes something called adipokines. Adipokines also secrete something called leptin. Leptin causes synovial joint inflammation. Pay attention to that. Okay. That joint inflammation is going to mess up your cartilage, causing knee problems. It could cause unnecessary unstableness in your knee. You damage your cartilage, osteoporosis, osteoarthritis. These things all happen and cause us problems. Number one, exercise. Number two, excess sugar intake. Number three, crossing your leg for so long. Number four, smoking. Number five, obesity. We cannot play with our knee. Okay, let's pay attention to that. My name is Nari Solomon, and I'll see you.